U.S. Surgeon General Vivek Murthy is sounding the alarm on a youth mental health crisis. A public health advisory from his office details how the pandemic has disrupted the lives of children, teens, and young adults, causing them to inherit anxiety, depression, and suicidal thoughts. The advisory points to recent research that includes 80,000 young people around the world, which found 25% are experiencing depressive symptoms, 20% have anxiety, and suspected suicide attempts for adolescent girls in the U.S. rose 51% in early 2021 compared to the same time in 2019. And for adolescent boys, that number rose 4%. And joining us to discuss mental health among youth are Judith Allen, the Clinical Director and CEO of Communities and Schools of Chicago. She holds a Doctor of Psychology degree and wrote a mental health guide before the Surgeon General's report was released. And Dr. Aaron Jansen, Vice Chair at Lurie Children's Hospital's Department of Psychiatry and Behavioral Health. He's also an Associate Professor of Psychiatry and Behavioral Sciences at Northwestern University. Welcome both of you to Chicago tonight. Dr. Jansen, I want to start with that most jarring number, 51% increase in suspected suicide attempts in early 2021 among adolescent girls. The number was about 4% for boys. What do you believe is behind that?
There's a lot of factors behind this increase, and I just want to pause for a second and just let that number sink in for everybody, because it's quite alarming. And unfortunately, it's a trend that started well before the pandemic. But the factors that are involved include, number one, kind of an increasing sense of despondency when disconnected from social groups, from changes in routine, from the pressures of social media. But more importantly than I think anything else is untreated mental illness, right? 1 in 5 kids will have a diagnosable mental illness by the time they graduate from high school. And only about half of those kids are ever given the opportunity to be exposed to any kind of evidence-based care. So we need to get kids identified earlier by more people. We need to be talking about mental health issues, and we need to be able to connect kids to the care they need.
And Judith Allen, you heard the Surgeon General today call it a mental health crisis. Your reaction to some of these numbers that you heard in this report that came out today?
Well, we were trending in that direction to begin with, and like Dr. Jansen said, this isn't a surprise, but it is alarming. It's also sort of a statement to what the pandemic has done with our kids in terms of isolating them from their connections. And that lack of connectivity really caused this to escalate as it did.
I mean, and I want to stay with you, Judith. Is there any idea why that suspected suicide number would be so much higher in girls than in boys?
Well, girls are typically, I don't want to say conditioned, but girls are typically a bit more social than boys. Girls are able to connect with others. You'll walk into a middle school and find a group of girls crying next to a set of lockers every Tuesday, because there's sort of part of that socialization, that networking that girls have. Whereas boys tend to be more insular. They tend to keep that inside. We see boys acting out more externally than internally. So if we have girls that are feeling despondent, disconnected, alone, and then like Dr. Jensen said, the escalation of social media as your only outlet, your only connection, then that becomes a very dangerous mix for our young ladies.
And some of those other statistics, Aaron Jansen, as much as a quarter or more of youth experiencing some kind of mental health issue, be it depression or anxiety, do they all have access to mental health care?
That's an easy answer. The answer is no. Most people don't. And particularly if you don't have the means to pay for things privately, or you don't have really good insurance, it's a real challenge to get any kind of good care.
And Judith Allen, the pandemic has exacerbated some of the problems that already were occurring. What about social media? Today, the CEO of Instagram was appearing before Congress about new controls to get kids off of Instagram, or to stop them from spending hours and hours and hours on there. Is that enough?
Honestly, and I'm not being critical of any type of social media platform, but I think the best response is to unplug it, to actually get children to put their phones down and walk away and interact with each other rather than focusing on that technology, that device in their hands.
And Aaron Jansen, how big a factor is social media, be it any platform or any app, when it comes to youth and mental health?
I don't think the jury is out yet. We need more studies to be able to understand it, because certainly what we hear from kids is that there's a connectivity and a helpfulness to some of the aspects of social media. And on the flip side of that, there is a sense of disconnection, of constantly having to be on, that can be quite deteriorating for mental health. We really need to study it and understand it. But I think as clinicians, we also need to educate parents about setting safe and appropriate rules around social media use so that we're monitoring, right? It's a tool like anything else. Some people, the tool is going to be used well and effectively, and in other hands, it's going to be quite damaging. I think what I want to caution, though, is that there's never going to be a single answer. Right? If social media were erased from our society with the snap of a fingers, we'd still be in a crisis. And we would still be looking for answers as to why kids are suffering so much as they are right now.
And Judith Allen, is this crisis felt more acutely in a specific sector of the youth population more than another, perhaps?
We're seeing it. We're seeing these numbers with children that are living in more marginalized communities, children of color, children where parents, whether they be first line responders and they're out of the house, there's more stress with those parents. And also students where they've experienced a lot of loss in terms of family members, friends, over the course of the last 18 months. So we are seeing it in some of the schools that we provide support to on the south and west sides of Chicago.
And Aaron Jansen, we have about 30 seconds left, but tell us the warning signs that parents need to look for.
We want to look for are changes in your child's personality, whether they're becoming more irritable, more despondent, when things start seeming like your child is not interested in things anymore. We want to look at sleep when it becomes dysregulated, whether if they stop sleeping or showering. What I would say is probably if you have any concerns that we should ask. It's important to note that asking about suicide is not giving people the idea, and actually having a space available for children to be able to talk about their concerns and their struggles is much, much more helpful. So if you have a concern, if there's any change, just ask. Ask for help, ask for resources.
All right, very important discussion. And our thanks to Judith Allen and Aaron Jansen. Thanks so much for joining us.
Thank you for having us.